We have a very young patient who has presented today to our office for a preoperative consultation for bilateral, left and right, toe shortening procedures of both second toes. Let's take a look at the right. So in respect to the right second toe, it's a little bit worse than the left in respect to the deformity. The patient has a little bit of a corn here and here. We'll also go ahead and get rid of these. And of course, just like we've discussed in the past, we really try to follow that, the normal quote unquote parabola. For people that don't know, this is called a Morton's type foot, Morton's toe, where the second toe is actually longer than all the others. And this is normal, and then all of a sudden, the second toe is longer than all the others. So the goal of the procedures, is to shorten the second toe in this case to obtain that quote unquote normal anatomical parabola. Let's take a look at the left. Same thing. We're looking at, and we were, I drew this here before because we were looking at the length of the great toe, the tip, right, of the great toe, and the third, and we were sort of talking that this would be the ideal, right, position where we would like to see the second toe. And that's exactly what we're going to do. And this little corn here as well, right, this little bump is going to be gone. No longer there. So the difference between the second of the right, you see, is different. We have one little bump here, one little bump here. Is different from here. She doesn't have it here in the distal interphalangeal joint. Now, in addition to everything that we have already discussed, we're going to go ahead and also perform what we call a little toe tuck. In patients who present with the Morton's toe, there is a little pouch of fatty tissue that accumulates here, usually on the side, on the lateral, right? This is a lateral, this is medial. And basically what we do is, using plastic surgery techniques, we're able to actually, remove some of that little pouch. I don't know if everyone can see, right? This is the way that it is now. We basically just thin out the toe a little bit like that by removing some of that fatty tissue to give the toe a more natural appearance. The same thing here. Walk in the same spot there for a second. March. And perfect. So now we can actually see it a little bit better. So this little pouch here, we're able to thin that out, and it'll kind of look like that. Like that. This is a great case. I love these toe shortening procedures. I will definitely keep everyone afloat on this patient's progress. Again, we're going to be performing toe shortening, bilateral second toes, left, right, in conjunction with the toe tuck, also known as the bulking of adipose tissue. I will definitely keep everyone afloat on this patient's progress. As always, www.josspodiatry.com, Instagram, Dr. Toe Jam, Joss Podiatry, Facebook, and last but not least, our YouTube channel, Joss Healthcare.